The United States healthcare system is facing a crisis. It is a slow-moving crisis, but it is a crisis nonetheless. This crisis revolves around long-term care, or LTC. LTC involves assistance with daily living activities. Think of things like bathing, dressing, and eating. As people age, they often require this type of care. The need for LTC is growing. The baby boomer generation is aging. This generation is large and they are living longer than previous generations. This means more people will need LTC in the coming years, but the cost of this care is already high and it is only going to increase. Many families are unprepared for these costs. They are struggling to afford care for their loved ones. This puts a strain on families, both emotionally and financially. The situation is becoming dire. This is a perfect storm. Rising demand for LTC, skyrocketing costs, and a lack of affordable options. This is a recipe for disaster. We need solutions. We need them now. Traditional long-term care insurance, or LTCI, was supposed to be the answer. It promised to protect people from the financial burden of LTC. But the system is failing. Insurance companies miscalculated. They underestimated how much care would cost in the future. They also underestimated how long people would live. This led to premiums that were too low. Now, companies are struggling to pay out benefits. Premiums are skyrocketing. Some policyholders are seeing increases of 200% or more. Many are forced to drop their coverage. They simply cannot afford it. New options are emerging. Hybrid life insurance policies with LTC riders are gaining popularity. These policies combine life insurance with LTC coverage. They offer a death benefit if LTC is not needed. This can make them more appealing to some consumers. States are also exploring solutions. Some are experimenting with payroll taxes to fund LTC programs. Washington State, for example, launched a program in 2023. Other states are watching closely. They are considering similar programs. The LTC crisis demands action. We need solutions that provide affordable and accessible care. This requires a multi-pronged approach. We need legislative reform. Regulations should protect policyholders from exorbitant premium increases. We also need to explore new ways to finance LTC. This could include public-private partnerships or government-funded programs. Employers can also play a role. They can offer LTC benefits to their employees. This can help alleviate the financial burden on families. This is a complex issue with no easy answers, but one thing is clear: we can't afford to ignore it any longer. The LTC crisis is a ticking time bomb, and the time to act is now.